Hello, and thank you for joining us tonight for our free webinar, the 2021 Neuroscience Acupuncture Conference Sneak Peek, featuring Dr. Michael Corradino, Dr. Hadar Elbaz, Peter Larking, and Dr. Helen. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. For over 40 years, LASA OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speakers, please make sure to use the Questions tab, and we will get to that at the end of the lectures. Please note that each webinar is recorded, and immediately following the conclusion of the webinar, you will all receive an email with a link to view the video on demand. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the LASA OMS blog. Now for our featured speakers. Dr. Corradino is the creator and president of the Neuropuncture Complete Neuroscience Acupuncture System. He has made it his professional focus to uplift our profession by integrating and teaching 21st century medical sciences as they are interwoven with the classical acupuncture model. Dr. Corradino is also the creator and president of the Neuroscience Acupuncture Conference, a conference purpose-driven to expose the acupuncture community worldwide to the groundbreaking 21st century neuroscience acupuncture clinical applications and share the most current neuroscience acupuncture research. Peter Larking has studied and practiced Chinese medicine for 25 years. In that time, he's achieved a Bachelor of Health Sciences specializing in acupuncture, diplomas in Tui Na, Qigong, Tai Chi Quan, and recently completed cadaver research at the MARC Institute in Miami, achieving the upper torso, head, face, brain, and spine dissection model. He is a former teacher and faculty member at the New Zealand School of Acupuncture, lecturing in biomedical sciences, neurological anatomy, Chinese medical theory, acupuncture, Tui Na, Qigong, and Tai Chi Quan. Helen K. Law was raised in a family of practitioners in traditional Chinese medicine in Hong Kong. She received her BA in Applied Physics and MS in Aerospace Engineering from the University of California at San Diego. After a successful career in aerospace research, she reoriented her career interest to traditional Chinese medicine and undertook studies at the Pacific College. She was board certified in 2000 and received her PhD in natural health in 2010 and Doctor of Acupuncture in 2019. And originally from Israel, Dr. Elbaz finished her military service there and then moved to New York and attended Hunter College to study nursing. It was there she realized her calling was holistic healing. She then went to complete her master's in traditional Chinese medicine at the Pacific College in 2006. She has taken her education further, graduating as a Doctor of Acupuncture in Chinese medicine from Pacific College in 2017. Being an Ironman triathlete and a double bronze Olympian in the Jewish Olympics herself, she continues working with athletes and elite athletes, treating not only injuries, but helping with prevention. All right, well, please join me in welcoming our panel, and I'm going to get off the stage and let them get to it.
All right, excuse me. So I'm going to jump in here and share my screen and get things started for us. Everyone should see my screen, correct? Yeah, all right. Okay. So, hello everyone, and welcome to the Neuroscience Acupuncture Conference LASA Sneak Peek. This particular sneak peek is for our October event, which is on October 23rd and 24th. And it is a biannual conference. We'll discuss that in a moment. And we had our last conference in February, and it was a fantastic conference. You could always check back in our post webinars through our websites at nacseries.com. Now, the theme for this conference is advancements in functional neuroscience acupuncture. Okay. And I'm going to give a little introduction. I'm going to go over the NAC organization mission and our vision for the conference, as well as the schedule before all those speakers give their little sneak peek. And at the very end, I have something very special that I'm going to be offering to everyone, all of the live attendees. Okay, so I'm Michael Corradino. I'm a doctor of acupuncture and oriental medicine. I completed my master's in the science of traditional oriental medicine, and I'm currently licensed as an acupuncture physician in the state of Florida. I'm the founder and president of NAC. NAC we call short for the Neuroscience Acupuncture Conference, and it is my great pleasure to bring to you our October 23rd and 24th weekend online international conference. I am very proud to present to you these incredible speakers with their most interesting and most relevant neuroscience acupuncture topics for today's conditions and situations we find ourselves in. So I want to give a little bit of history about the NAC in case you're new to the organization. Now, some of you may be familiar with my work, but I have had the privilege of traveling the world and speaking at different conferences from all over North America to Israel, from Australia to New Zealand, to Belgium, to Denmark, and even China. But I never came across an entirely science-based acupuncture conference. There was always a lecturer or a topic or some presentation on the energetics of our medicine or the mysticism of our medicine. And it would always kind of turn me away a little bit. And I've always asked presidents of other organizations if they would do something like put together a science-based acupuncture conference to illustrate the power of our medicine and scientifically validate it and help us project it forward in the area that we need to put it, which is in the heart of mainstream medicine. So what we decided to do was create a NAC series, okay? And me and my team decided to put this together, and this is a special event for October 23rd and 24th. This conference is dedicated to the 21st century scientific acupuncture medical arena, okay? We're always going to include medical arts and sciences that are based all on the acupuncture model, focusing on clinical applications to current neuroscience acupuncture-based systems, as well as neuroscience acupuncture research with groundbreaking international speakers. So the NAC mission and vision is simple. We at the conference and at the organization, the Neuroscience Acupuncture Conference, is dedicated to the integration of acupuncture with neuroscience in order to advance the profession and improve clinical outcomes. Now, in the past 20 years, there has been just an explosion in the area of neuroscience understandings of the brain and the mind-body connection. And acupuncture, as we know, is neuroscience. And a simple example of that is the DACM phenomenon. Now, our goal is to bring 21st century medical sciences and their clinical applications to the acupuncture profession, raise the bar of scientific evidence-based acupuncture education so we can all learn how to communicate our medicine to our patients and other healthcare providers and our referring physicians, as well as present groundbreaking neuroscience acupuncture scientific research. Okay, there's been, again, a lot of excellent neuroscience research in acupuncture that we want to bring forward to our profession so that you guys get to really see the advancements that acupuncture is making. It is our belief that this will assist in galvanizing acupuncture into the heart of mainstream medicine where we believe it belongs. Now, there is the conference. It is Saturday and Sunday, October 23rd and 24th. We have, again, the theme is advancements in functional neuroscience acupuncture. So that theme functional will be applied through all of the speakers' titles. And there we have the three of our speakers today presenting. We have Dr. Hadar Elbaz from Israel, Peter Larking from New Zealand, and Dr. Helen from New Jersey, and originally from Hong Kong. Dr. Hadar Elbaz will be speaking on October 24th. That's a Sunday. She'll be doing the morning shift from 8 a.m. to 12 p.m. before CEUs and PDAs. And the topic will be the role of amino acids and neuroscience electrical acupuncture prescriptions in functional medicine, keeping that functional theme in play. We have Peter Larkin speaking at a whole day workshop, October 23rd, Saturday, from 8 a.m. to 5 p.m. Peter's going to be discussing functional neurology, how to assess the cranial nerves, all 12 of them, which ones they are, where their pathway lies, and the pathology of them, as well as neuropuncture electrical prescriptions on how to neuromodulate those nerves back into health. And then we have Dr. Helen speaking on Sunday as well, October 24th from 1 p.m. to 5 p.m. for CEUs on functional applications to her own neuroscience acupuncture research that she published on tinnitus and hearing loss and COVID, loss of sense of smell and taste. Very relevant to today's topics. So thank you again. I'm Dr. Michael Corradino, founder and president of the NAC series. You can find our information on the NACseries.com. Again, our event is October 23rd and 24th, 15 CEU, Saturday and Sunday. It's online, international. Watch it from the comfort of your home office or couch with a glass of wine or a cup of coffee or tea, whatever sets your pleasure. Emphasis will be on clinical applications, and it's all neuroscience, electrical acupuncture. And at the very end of this, at the end of the speakers, I have a very special offer and special announcement to make to all the live attendees, so stay tuned. And now, please, without any further delays, here's Dr. Hadar Elbaz.
Awesome. Thank you so much, Dr. Corradino. I'm so excited to be here tonight, and thank you for everyone participating, and thank you for everyone watching us. I'm just really happy to be here, and I'm really excited to speak on the 24th of October about the fascinating topic about neuroscience and acupuncture, functional medicine and amino acids and the role in electrical acupuncture prescriptions as well. So let's dive in. So what is functional medicine? Let's start with that, and how is it related to neuroscience? So functional medicine is a systems approach that identifies and addresses, of course, the root cause of disease. So when I treat patients in functional medicine, I always look at what the root of the disease, the root cause is. And I always look at different varieties. So for example, their environmental toxins, their environment in general, what are their emotions like? What is their mood like, right? What are they eating? What supplementations are they taking, or lack of supplementations? Their sleep habit, their lifestyle. So these are huge components of part of how we treat and what we look at when we treat with functional medicine. So let's, for example, look at this little illustration here and look at the depression, right? So we have a condition, and we have many causes that can affect that condition or can cause that condition. So depression, for example, can be caused from hypothyroidism, from a low vitamin D level or low vitamin D levels, gut microbiome dysbiosis. So when you don't have enough of the good friendly bacteria and too much of the bad bacteria in your gut. And as you know, neurotransmitter serotonin, for example, is 90% made in the gut. So it will affect your mood, of course. We also look at inflammation, right? Inflammation can cause depression. So we have that one condition, depression, and we have many causes. And vice versa, we have a cause that has many different conditions that affect it. So we were talking about inflammation, and as well as neurotransmitters imbalance, for example. And that can be caused by, let's say, arthritis, right? Cancers, depression, lack of sleep, insomnia, panic attacks, anxiety. So we always have to look at the conditions and the causes that affect the patient's illness or ailment and how to actually go about it. And that's the beauty of functional medicine, because we look at the root cause, we look at the entire environment from A to Z, and then we treat accordingly. And, during COVID times, since 2020, I had to take my practice and kind of transform it into an online functional medicine and telemedicine. And so functional medicine and telemedicine is a great way to treat with functional medicine. I have patients all over the world, in fact, in Israel too, for example, and it's a great way to treat patients. And what you can do with functional medicine, which I love, is order lab tests, right? So you can order lab tests wherever they are, and you can do it all online, and I'll go about that in a little bit. And then accordingly to their symptoms, to what they're dealing with, their lab tests, we can treat, and we can literally change their lives and their lifestyle by guiding them with telemedicine, right? How to go about it with nutrition, with supplementation, with lifestyle, and all around that. So it's such a great way to go about treating patients. And so why is functional medicine relevant here? As we know, neuroscience is a study of the nervous system, and it combines the physiology, biology, anatomy, and so on. And neurotransmitters, which are obviously part of our neuroscience, which are chemical messengers that are used to by the nervous system to transmit signals between neurons or nerve cells, as we call them, right? And you cannot be alive without having neurotransmitters work properly. Basically, neurotransmitters work endlessly at all times to keep our heartbeat, our breathing, our learning, our memory, concentration, and also psychological, right? So fear, joy, pleasure, neurotransmitters are so important. So it's crucial to keep them balanced, right? And as we know, neurotransmitters, of course, are released from the axon terminal, as you can see in this little illustration, and they're released after an action potential has reached the synapse, right? And the action potential is actually the transmission process, which involves the electrical impulse. And so we have the presynaptic and the postsynaptic and the synapse in between that. And we'll go more over that during the conference as well. Neurotransmitters are classified into three categories, basically. And we're very well familiar with the excitatory neurotransmitters, such as epinephrine and norepinephrine, or adrenaline and noradrenaline. And when they are excitatory, they have an excitatory effect on the neuron, increasing their likelihood to fire an action potential, right? So we also have the inhibitory neurotransmitters. So inhibitory means they will likely not fire an action potential. So GABA, for example, and serotonin, so gamma aminobutyric acid and serotonin are examples of inhibitory neurotransmitters. And then we have the modulatory neurotransmitters, which affect large number of neurons at the same time. And the difference is between excitatory, inhibitory, and modulatory is that the modulatory are slower to act and move, unlike the regular synaptic neurotransmitters, which are faster to act and move. And the modulatory combine both excitatory and inhibitory neurotransmitters. And examples are acetylcholine, dopamine, serotonin, norepinephrine. And I will go over that during the conference. So love those neurotransmitters. And this is exactly, so I will be discussing some of the main ones that I'll be discussing during the conference are GABA, which is again, gamma aminobutyric acid. And GABA is both a neurotransmitter and an amino acid that is calming, and it's inhibitory. So that means they're not going to fire the action potential, right? Glutamate is its antidote, so that will be an excitatory neurotransmitter. And then we have the catecholamines, which are a big umbrella for the dopamine, norepinephrine, and epinephrine. And catecholamines are actually made by the adrenal glands, specifically the adrenal medulla. And they are made in response for physical and emotional stress. And of course, we have our well-known serotonin, which is 5-HT, so 5-hydroxytryptamine, unlike 5-HTP, which is the precursor for serotonin. And I'm sure you're familiar with that amino acid as a precursor, and I will be discussing those too. But serotonin is our feel-good hormone. A lot of women, for example, are deficient in that, and it can drop during the afternoon, evening. And I'll go over during the conference about their deficiencies or what happens when they're imbalanced and how to go about treating those. And as you can see, the little cascade of events here are precursors: tryptophan, 5-HTP, 2-serotonin that then turns into melatonins to help us sleep. And every cascade of event here needs different minerals and vitamins to function. And if we don't have those, they will be deficient, causing an imbalance. Okay. Acetylcholine, of course, is our well-known neurotransmitter, that is the most active one in every single action that we actually have and do in our body, especially in the parasympathetic nervous system. And acetylcholine is responsible for our muscle movement, our pain sensation, learning, memory, as well as regulating our endocrine system and REM sleep. Of course, deficiency would be impaired memory and movement, such as we see in Alzheimer's and Parkinson's. So let's talk about lab testing for neurotransmitters. And it's very important to actually work with a lab before you really prescribe anything to a patient. I do believe, I'm a great believer in lab testing, blood testing, urine testing, saliva, whatever needs to be done to really see what are the disharmonies that the patient has, whether it is neurotransmitters, whether it is vitamin deficiencies, hormone imbalance, thyroid, whatever it is. You always want to make sure you treat before you give any kind of supplements, any kind of nutrition, any kind of guidance. And so my favorite test for neurotransmitter is actually just a simple urine test. Here I'm talking about the Dutch test and the oat test. So the Dutch is the dried urine test for comprehensive hormones, which today they actually upgraded it and added the organic acid testing to be able to test more for neurotransmitters. Now, the Dutch test is an extremely comprehensive and complex test, as is the organic acid testing. So I personally like the more simple one where you do the urine test and you pee in a cup for a few times a day, and it really shows you the levels. However, you have to be aware that when you do the neurotransmitters testing, you can have a little bit of inaccurate reading, especially because the few days before you do these tests, you have to avoid certain foods like bananas and other foods. And so if a person still eats them, that's going to throw the numbers off a little bit. Not completely, but still it's going to throw it off. So be aware that if you do treat a patient and you do those tests, that they have to be very careful and strict about how they and what they eat and how they test, right? So I highly recommend just a simple urine test, and I'm going to go over the actual labs that I work with and that I recommend to do those tests with. But please note the Dutch test, the oat test, and of course, you can do a comprehensive hormonal test with the Dutch test. And different labs. My favorite one, of course, is Vibrant America. I've been using them for a long time, and they are wonderful. They're very comprehensive, and they offer everything. And you have a rep who actually can guide you and help you. And you literally you can have concierge services to go to patients' houses and draw the blood, and they will refer you to that. Or you can send the patients into Quest Diagnostics. And so Vibrant America is great. It's reasonable pricing. It's not bad. They literally offer everything from micronutrients to wellness, Vibrant Wellness to everything, to hormones, to everything. Then we have directlabs.com, and that's an online lab that anyone can purchase from. And it's more an a la carte type thing, so you can pick and choose. I feel that it comes out to be a lot more expensive. And you don't really have much guidance. With Vibrant America, you can have the concierge at your service, if you will, and the rep to actually help you. Of course, Quest Diagnostic and LabCorp, which is here in Florida, and actually everywhere. And then Life Extension, which I'm sure you've heard of as well. I know I have some patients that just want to order their own lab tests, and they just go to Life Extension and order whatever, and then they bring it to me and I read it. But these are the main companies that I like. I'm sure there are more, but I highly recommend Vibrant America. They're great, and they're pretty fast with the results and very good overall. During the conference, I will also be discussing some genetic mutations and how they do affect neurotransmitters. Very, very important. So my favorite one is MTHFR, and there is a nickname to it, which I'm not going to say right now, but you can only imagine it's called a mother disease, right? But it's a very, very common genetic mutation, and unfortunately, over 30%, and I really feel like it's more than 30% of the American population, just American alone, and it's all over the world. A lot of people have it, they don't even know they have it. And I'm going to try and say what it stands for. So MTHFR stands for methylene tetrahydrofolate reductase. It's a mouthful name. But it is an enzyme that when it is mutated, it will affect not only your genes, of course, it will affect your mood, it will affect the way you detoxify, from environmental toxins and toxins in general, and it will affect the way you make neurotransmitters. So if you have that mutation, and you can have different kinds of mutation in the MTHFR, so you can have heterozygous or homozygous, right? And if either one or both are mutated, they will not be able to convert the folic acid, which is toxic for those who have it, into the active form, which is L-methylfolate. And L-methylfolate is very, very important in making neurotransmitters, right? So it's important in making our serotonin, our dopamine, norepinephrine, to help regulate our mood, our anxiety, or prevention of anxiety and depression, and overall just make us feel happier. So it is crucial to test for this, especially when you have patients that are depressed constantly, no matter what you do. They feel foggy-headed, they just don't feel well, they have illnesses all the time, all kinds of random diseases, they don't absorb vitamins, their B12 is low, like so many different things can happen. And if you don't test for MTHFR, I feel like you're missing a big link here to help the patient accordingly. So highly recommend testing for it. I will be speaking about it more in the conference. I will also be discussing impaired neurotransmitters and how to balance them with certain amino acids and food and nutrition. Very important, of course, to help our well-being. So a little bit of what I'll also be discussing for us now, a lot more, but a little bit of a pearl here is the neurotransmitters that I'll be talking about. Mostly, or some of them are here, they're GABA, the gamma aminobutyric acid, which, as you recall, is also a neurotransmitter, as well as an amino acid. And this is our inhibitory calming supplement, as well as the neurotransmitter. But GABA is great for anxiety, it's great for sleep, it's also great for addictions and alcohol addictions, okay? We'll discuss more of that. L-theanine is one of my favorite of all times amino acid. L-theanine is great for anxiety, and it can be an anxiety that is very specific also for caffeine toxicity. So if a patient comes to you and they're so shaky, they're nervous, they don't know what to do, they don't know what they did, they had a cup of coffee and suddenly their heart is racing, they're dizzy, give them L-theanine. That is going to be their counteracting amino acid for caffeine. That's going to help neutralize caffeine, for example, and calm them down. It's great for sleep. And then, of course, taurine is a great amino acid to help reduce the potassium for the channels, the neuron channels, and help calm the body and not fire. And then, of course, 5-HTP, which is the precursor for serotonin. So I'll be discussing those, and then some more. Of course, I'll talk about magnesium, which is not an amino acid, but it is a great supplement that is also very important in calming anxiety and good for insomnia and much more. And I'll discuss how to combine those amino acids into different combinations and formulas to treat insomnia, anxiety, depression, and more. And another clinical pearl, which is going to be very exciting, is going to be the neuroscience electrical acupuncture prescriptions to integrate them with amino acid therapy to help target specific neurotransmitters receptors. So very excited to be showing what neuroscience electrical acupuncture prescriptions we will be using to help target those specific neurotransmitters, to help calm the mind, to help calm anxiety, depression, and so on. Very excited. So I am thrilled to be here, and I'm very excited to be at the conference teaching those. So really grateful. Thank you so much for being here. I'm really excited to listen to the next speakers here who are brilliant. And thank you so much, Dr. Corradino, and thank you everyone for being here. And I'll see you guys on 23rd and 24th. Thank you.
You got it. Thank you, Dr. Hadar. That was fantastic.
My pleasure. Thank you.
And we're all going to be looking forward to hearing her presentation on the 24th. And we'll get to some Q&As after this at the end of all the speakers. And next up will be Peter Larkin. Take it off.
Hi everybody, my name is Peter. I'm live streaming all the way from New Zealand on Wednesday rather than Tuesday. Here to all you guys. And what we're going to do is we're going to have a quick chat today and have a look at the overview of what we're going to be covering in our 6-hour lecture. So let's have a quick look at what we're going to be doing. So firstly, course objectives. We're going to be looking at anatomy and physiology of the 12 cranial nerves. We're also going to look at the assessment and treatment of these particular tissue structures. So that's a big day. You could spend a whole day on one of these nerves. So we will be keeping it reasonably basic and getting a good overview. So let's have a quick look at the learning outcomes that we're going to be going for. When we're doing the anatomy and physiology, what we're going to do is gain a foundational understanding of the anatomy of the 12 cranial nerves, inclusive of their origin, the course that they flow through, the foramen that they move through, and their modulating nuclei in the midbrain, brainstem, and pons. We're going to go through the physiological functions of the different cranial nerve fibers to understand how they work and look at the different tissue structures that they supply and the basic function of those tissues. This will be really critical for assessment and diagnosis. Whilst we're doing that, I will be drawing correlations between the traditional Jing-Lo-My channel network pathways and pressure points with modern neuroanatomical structures to help that transitional evolution of the acupuncture mindset into the 21st century. As we get into assessment and treatment, we're going to look at practical skills for functional neurological assessment of the 12 cranial nerves. If you have interest in things like TBI, stroke, post-concussion syndromes, complex migraine, these structures are absolutely critical that we understand how to assess them correctly and what to look for. We'll be looking at abnormal findings that we commonly encounter in the clinical setting, and we'll be going through those and then thinking about the neuropuncture clinical process to create a diagnosis, a treatment, a prescription, and a dosage for these particular cranial nerve structures. So let's have a quick chat about the cranial nerves. We'll just do a real brief overview and get a feel for what we need to know. So firstly, there are 12 of them, and they come out of the cranium and supply a lot of different tissues in the body, particularly the head and face, but also 90% of the parasympathetic outflow. They have different fiber modalities. So most people will be aware of motor fibers and sensory fibers, but there are many subclasses of these different fibers. And when we understand what the fiber does, then we can understand how to assess it and intervene with it clinically. We're very interested in the origin of the nerve. Where does it start within the cranium and how does it move through those structures? We need to be aware of the modulating nuclei that they communicate with within the midbrain, the pons and the medulla, and a little bit in the spinal cord, and different ganglia that they are attached to as well. We're going to look at all the different foramen that they move through along the base of the skull. This is very clinically relevant in the context of diagnosis. We're going to follow through the pathway of the nerves. Where do they actually go? How do they terminate in the tissue structures that they communicate with? We're going to look at the supply tissues. What are the functions of those and therefore how to assess them? Okay, so moving forward, let's just have a quick chat about cranial nerve fibers. Essentially, we have sensory fibers. They're going to pick up information from our environment and feed that back to the central nervous system, and motor fibers that will respond to that information. But the cranial nerves have very specialized nerve fibers that are particularly associated with things like sound and sight and smell and taste, as an example. Today, I'm going to give a little example of a particular fiber, which is called a general visceral afferent. So this is a sensory fiber that picks up information from the organ systems. So we'll talk about the vagus nerve briefly today because that's one that we all sort of know about, and we'll give an example of how we might assess that and also how we might use a functional anatomical unit to treat that structure as well. Okay, so one of the other things that we really need to know is that the skull has lots of holes in it. Okay, now we were very lucky a couple of years ago with Dr. Mike when we were doing a dissection of the brain. We got to have a really good look at the base of the skull and put our fingers in here and feel all these foramina. So what are these little holes and why are they important? So firstly, these holes transmit numerous structures like the cranial nerves, blood vessels, and other types of anatomical references as well. Now, the reason why they're important is firstly in diagnosis. What we'll often see in clinic with post-concussion syndromes is a person will have a head tilt. You know, the head is tilted to the side and they're leaning away from an injury. This is actually going to change the way that these nerves conduct information from the body to the brain. So a really good example of this would be the vestibulocochlear nerve, which is going to affect balance and spatial awareness. Secondly, we can actually target specific foramina. So a good example of that is the jugular foramina. This has the glossopharyngeal nerve, it has the vagus nerve, and the accessory nerve moving through the structure. If we were needling something like gallbladder 21, the motor point for the trapezius and the motor point for the sternocleidomastoid, when you get an electrical pulse running through that, that electrical current is actually going to travel through that foramina and up to the terminating nuclei that are associated with those nerves. So we can actually target specific foramina to communicate with specific nuclei in the brain. So it has a really strong clinical relevance in the context of diagnosis, but also in the way that we choose and select locations that we're going to be stimulating. So we're going to have a very, very detailed look at these structures and who passes through there and the types of tissues that they supply from that location. So tissue supply is really important. Essentially, these nerves are going to supply an absolute boatload of tissues. So an example would be the cranial nerve 2, cranial nerve 3, cranial nerve 4 and 6. They're going to supply the eyes. So eye movement, reception of vision, and we need to know what tissues they supply so we can assess the function of that tissue structure. This leads to good diagnosis and good treatment strategies. What you can see in this image here is there are a lot of different tissue structures for us to cover. We will be spending nearly half a day just on the anatomy and the supply of those tissues. That's how long it's going to take to go through all of that. And then we can go through and look at what do those tissues actually do and how do we correctly assess them. And that's going to be the big goal for the day. So they are just absolutely beautiful structures for us to be working with. And for acupuncturists, I really want us to encourage you to recognize that these particular fibers have a lot of crossovers with the Jin-Lo-Mai systems that we all got taught in our traditional training. So why don't we do a little example of what we're going to do on the day? Let's take the vagus nerve because it's one that we're all commonly aware of, and it's a very important cranial nerve in the context of its function. We'll take one fiber from the cranial nerve, look at its course, how it flows, and then we'll do a little quick conversation about how to assess it and treat it. So firstly, vagus nerve, obviously there's been a big buzz about the vagus nerve for about 10 years or so now. Everyone's talking about it. I hear people saying they're stimming up people's ears. But the reality is it's far more complex than what we think. So firstly, when you look at a cranial nerve, if you see that it has 5 different types of fiber modalities, what you can guarantee is it's an incredibly complex structure. So the cranial nerve has multiple different fiber modalities that perform an absolute truckload of different mechanisms inside the body. What we're going to look at today is we're going to look at the general visceral afferent. Okay, so the sensory fibers that pick up information from the organs and communicate that to the brain. Very important structure for us to be aware of as acupuncturists, because when we do pulse diagnosis, that's what we're actually listening to. is these general visceral afferent stimulations coming from the organ systems. So supply tissues. I'm not going to go through them all because you could spend a whole day on this, but we can assess the larynx and pharynx with the vagus nerve, the thoracic viscera, so the heart and the lungs, the abdominal viscera, and that is almost the entire abdominal viscera apart from the lower 2/3 of the large intestine and the reproductive system. The epiglottis, which is very critical for swallowing and for stroke rehab. We'll often see people lose the function of that structure. Interestingly, the ear, which I think most people are starting to tune into a little bit, and the tympanic membrane. So this is a big nerve, right? It covers a lot of territory, and we're just going to have a real micro look at one of these structures. So what's the function of this particular nerve? So we have what's called the cranial sacral outflow. This is the parasympathetic control over our body, and the vagus nerve controls 90% of that. There are other nuclei in the brainstem, like the oculomotor nerve and the facial nerve, that do have some roles in the head and face, but the vagus nerve will do all of the parasympathetic outflow for the organs. So some examples. We have the pulmonary plexus. This controls bronchoconstriction of the lungs, as an example. We have the cardiac plexus, which slows the heart rate down. Now, this is very clinically relevant. You would want to avoid doing that in certain circumstances, and you would absolutely want to have that happen in other scenarios. The esophageal plexus, this has a lot to do with the stimulation of motility of the digestate and gastric emptying, balancing of acid secretions in the digestive system. We have the hepatic plexus. This is absolutely fascinating. This is actually stimulated by the left vagus nerve pretty solely, and it regulates things like appetite, metabolism, through detection of glucose and lipids and different GI hormones, which is an absolutely fascinating mechanism of these GVA fibers that we're looking at today. On the opposite side, coming off the right vagus nerve, we have the celiac plexus. This is going to innervate the intestinal tract for peristalsis, as an example. We have both motor and sensory innervation of the pharyngeal plexus, which is very critical in stroke rehab, and sensory innervation to the ear. So a very important structure for us to be able to assess and treat. Let's have a wee look at the GVA fibers and what they do inside the cardiac plexus. So firstly, the way that it moves is that we have what's called baroreceptors. They attach to the carotid bodies and the aortic bodies within the heart. They flow up from there into the inferior ganglion of the vagus nerve. They move through the jugular foramen, that little hole in the skull that I was talking about, and they terminate at a very special location in the brainstem called the caudal tractus nucleus solidaris, or the nucleus solidaris for short. Now, I know my accent's pretty weird there, so just excuse that. I can see you guys all smiling away. This is a critical structure for us to be aware of, though, because it controls the cardiac function of our body. And when we start to modulate the structure of this and its function, we're going to see changes in our pulses. And that's something that all acupuncturists will be comfortable with. So what I want to do is a little clinical example of how I might assess the baroreceptors of the GVA fibers of the vagus nerve and look to create changes that are palpable in the pulse and accessible with something like an oximeter. So vagus nerve assessment, what are we looking at? How do we assess the structure? So firstly, as acupuncturists, we're all looking in the mouth, right? Everyone's looking at the tongue all day long. But are you taking notice of the subtleties in here? For example, is the uvula sitting straight? Maybe it's deviated to one side. Maybe the laryngeal arches are atrophied, as an example. Yep. These are going to tell you a lot about the glossopharyngeal nerve, the accessory nerve and the vagus nerve, as they all move through the carotid sheath together to supply the whole laryngeal plexus. Other techniques that we could utilize here is we could actually touch those laryngeal pillars and induce a gag reflex. Sometimes you might have a gag reflex on one side, but not on the other, which would give you a lot of indications about upper and lower motor neurons and where lesions might be and how we might go about treating those. We can assess things like, can they cough, as an example. Get them to swallow water and look at the constrictor muscles moving and actually see how they move. We can listen to things like phonation. You know, the tone of the voice. Is it dry? Is it raspy? Is it weak? You know, can they articulate? Maybe they have a lisp or certain sounds are not coming through correctly. These are all indicators of vagus nerve structures. Interestingly, acupuncturists do a lot of assessment of the vagus nerve without being aware of it, because when we do our 10 questions, we're asking about cardiac function, respiratory function, GI tract motility, immune changes, mental health, sleep patterns. All of this questioning that we're doing is very indicative of the balance of the autonomic nervous system. And of course, the vagus nerve is going to play a massive role in that. Now, we're talking quite specifically today about the GVA fibers and the sensory information coming from the heart. So what would be a good way to assess that? I think acupuncturists have got a good idea. We want to take the pulse, okay? But one of the things we have to realize is pulse diagnosis is horrendously subjective. If you get 10 acupuncturists into a room, all taking one person's pulses, everyone gives a different diagnosis, and that's a little bit problematic. But there are some stats that we can take using a simple oximeter. This is a really powerful tool for acupuncturists to be aware of, especially with electroacupuncture. So when we monitor heart rate variability, the ability for the heart rate to go up a little bit when you breathe in and go out a little bit when you breathe out, what are we actually looking at there? So really importantly, the intrinsic heart rate is between 60 to 80 BPM. That's the contractile and nodal cells of the heart working by themselves to generate their own action potential. When we have a heart rate above 80 BPM, we've got sympathetic outflow taking place. And when we have one below 60 BPM, we have parasympathetic outflow, okay? So let's say, for example, that our patient comes in and their blood pressure is 150/90. They're hypertensive, yep, and their heart rate is 95 BPM. What you want to do to lower that blood pressure is you want to inhibit the heart rate. And it's the vagus nerve's job to do that. So we need to be able to target the vagus nerve somehow to get that to inhibit the heart rate. Vice versa, though, if you have a hypotensive patient and they have, say, a blood pressure of, say, maybe like 95/60, what's going to happen is their heart rate's going to be quite high. It's going to be about 115. And the heart rate's doing that to compensate for the low blood pressure. So in that context, you don't want to stimulate the vagus nerve because you're going to give them low blood pressure, right? So it's not as simple as sort of saying, oh, you know, I stimulated the vagus nerve by putting needles in their ears. You actually need to be careful with that because you might do someone harm. So we can monitor heart rate variability during assessment. Very importantly, if you're, say, assessing, say, the vestibular oculomotor reflex, and it really stresses the patient out, you're going to see changes in the heart rate with that to indicate that to you. So it's a very valuable diagnostic tool in assessment. During treatment, if a patient's lying there and they've had a head injury and you're putting 45 minutes of E-stim in, what you're going to find is their oxygen's going to really drop out and their heart rate variability might become quite inhibited. This means you're putting the nervous system under too much stress and they're not coping with the treatment. So it's a very, very useful tool to assess inside our clinical management. So what would be a functional anatomical unit that we could target with electroacupuncture that's going to, A, have an effect on the vagus nerve and its GVA fibers to inhibit the heart rate and stimulate the caudal tractus nucleus solidaris? Well, it's surprisingly simple. This old bad boy, right? Zhu Li, we've all needled it an absolute truckload of time, and we know there's a big body of research for this location. If we stimulate this at 2 hertz for 20 to 30 minutes, what it's going to do is it's going to target regions within the hypothalamus, particularly the arcuate nucleus, within the midbrain and brainstem, particularly the paraductal grey matter, and specific nuclei that pick up sensations from below T6 in the body. What happens when you stimulate that is it's going to kick out a neuronal nitric oxide synthase. This is a vasodilator, which is going to dilate blood vessels systemically. Now, think about what's happening there. If we go back to the earlier slide, when those blood vessels dilate, the vagus nerve is going to pick that up from the stretch receptors at the corded bodies, and it's going to send that signal back to the nucleus solidaris to say, hey, blood vessels are dilating. We need to inhibit and go into a rest and digest status. That will then send a signal out through the motor fibers of the vagus nerve to inhibit the heart rate and lower the blood pressure. So very interestingly, we all know what it's like when we're working in clinic and we needle something like anterior tibial nerve and we feel the pulse dilate. It's wiry, it's tight, it's rapid. You put the treatment in for 20 minutes and the pulse dilates. Well, actually, it's a cranial nerve that controls that mechanism through feedback loops from the hypothalamus, the periductal grey and brainstem, out into humoral changes in the bloodstream, which dilate those blood vessels and then in turn regulate the cardiac control center of the brain, which then controls the heart rate. So when we start to have a deep look at this and understand exactly how these cranial nerve structures work, their supply tissues, and how to assess them, we can really grasp a lot of the mechanisms of acupuncture in that context. So look, I'm super excited to have one day with all of you. This is going to be absolutely massive. We're going to be doing this deep study of all of the anatomy and physiology of these cranial nerve structures, how to assess, and some clinical gems of how to treat them as well. I think that this is particularly impactful for anyone that has interest in treatment of things like TBI, treatment of stroke, complex migraine, headache, cardiac, GI tract function, the list goes on. So I'm really looking forward to going through that with you and sharing with you all my years of experience of working with cranial nerves and using functional neurological assessment with electrical acupuncture techniques to modulate and rehabilitate these structures back to health.
Wow, Peter, are you finished?
Yep.
That was fantastic. I hope everyone took some notes on that and the impact of not only the pathway and influence of the vagus nerve, but also stomach 36 at 2 hertz millicurrent, 20 to 30 minutes, and its impact on the vascular system. That's fantastic. Thank you, Peter, so much for introducing that. And next up will be Dr. Helen Law. And I believe Jeff will be kicking in the slides for her. There you go. Perfect. And Dr. Law, you go.
All right. Thank you so much for Dr. Hadar and Peter giving such a detailed description of the neurotransmitters. And Peter, thank you for supporting my next part of the talk about the cranial nerve. So my part talk would be the application of all the research. And we've seen all the detail of the cranial nerve. How do we apply these techniques and knowledge into treating tinnitus, hearing loss, and COVID loss of sense of smell and taste? So research, what I consider is, I'm so passionate about it, it's so creative, systematic, diligent, challenging, try out new ideas, experiment with cutting edge technology. increase our knowledge, and help us to deeper understanding what we're dealing with. It is so exciting and rewarding. Now, neuroscience research is even more exciting. It is all about the nerve system. Your brain controls everything, all the things that make us as a human. So acupuncture is a neuroscience. As we see more and more with the talk and we learn, acupuncture is neuroscience. And the functional application to neuroscience application research is definitely in high demand and now in the current medical world. So neuroscience dramatically reshaped the biological sciences across the globe over the last 50 years. These advances brought us closer to be able to rigorously explain how the brain interacts through trillions of synaptic connections. Now, in the process, an entirely new field opened up, ranging from neurobiology, neurophysiology, neuropharmacology, behavior, developmental, cognitive neuroscience, even to consumer products such as soft drinks that offer neuro benefits. I don't know, personally, I haven't tried any of this drink, but imagine they offer neuro sleep, okay, and neuro sun, neuro sports, and neuro trim. And I would like to try these drinks to see if it actually offer any neuro benefit from us, okay. So, so there has been explosion of neuroscience research article published in the past 10 years, particularly in the neuroscience acupuncture research and also neuroscience electroacupuncture articles. They're booming from South Korea, Germany, and of course China and all over the globe. But why? Why is all of a sudden this research becoming so available to us? It's because there's a modern neuroimaging techniques make it possible, such as fMRI, PET scan. So the MRI basically is seeing the cerebral blood flow and the neuronal activities in the brain. And then the PET scan, also we get to see the metabolic process, blood flow, chemical composition, absorption. I want to give you an example. So the MRI image of acupuncture on gallbladder 34. I just want to say a little bit about the gallbladder 34 because I'm sure the acupuncturists here know about that. And then the audience may not be acupuncturists. Basically, it's a point on your leg, you know, on the lateral side below the fibula bone. So why would they stimulating that point on gallbladder 34? What does that happen? You actually activate the prefrontal cortex in Parkinson's disease. And also we know that by stimulating that point, also stimulating the enzyme that helps to synthesize the dopamine for the Parkinson patients. So in the past, the neural mechanisms of acupuncture was not really well understood. But because we have the past decades, increasing number of the study have used the modern neuroimaging techniques to investigate the response. So we can actually see what happened when we stimulate at acupuncture points and what happened to the brain and increase the blood flow to the brain. So there are also other modern neuroimaging techniques such as neuro EEG and dot scan, which is the dopamine transporter scan, and the heart rate variability, which Peter mentioned a lot about it, which I'm not going to go through in such a detail. But I just want to bring the imaging on the right side, and you see that the one on the left side, it's normal basal ganglia. On the right, actually see that the circle and the blood flow actually was less, and that shows the atrophy on the basal ganglia, which we use the dopamine transporter scan, be able to confirm Parkinson's disease, which we were able to do that in the past. Most neurologists using the clinical observation and determine whether you have Parkinson or not. Now that we have the scan, we're actually getting very excited about be able to confirm the atrophy of the basal ganglia. And So all these modern neuroscience technology and research have helped us to better understand the mechanisms underlying acupuncture and be able to apply them in the clinically. So I don't have the time to go into detail the unique neuropuncture clinical process, which I will go through that in detail in the conference. So more important, not just understanding, but we're able to better communicate with our ancient and the powerful medicine to other medical practitioners. And so we are actually be able to speak in the 21st century medical language. Let me just say a little bit, because I have quite a lot of referral medical doctors send patients to me. And I hear the patient comes to me saying that, yeah, my doctor tell me to come to see you, that know that you can help me. However, I really don't understand what acupuncture is. So in other words, if we actually be able to speak in the language and the medical doctor would really truly understand what we're talking about, what is the mechanism of acupuncture? So then we're gonna go through a little bit about what is neuropuncture. Okay, so what is neuropuncture? Neuropuncture is a special system of acupuncture system that combine neuroscience and other Western medical science and current evidence-based acupuncture published research articles together with classical TCM acupuncture model. In other words, we are talking about neuroscience and acupuncture, but we're not forgetting what we know about the TCM, which is the traditional Chinese acupuncture system. So the only thing is that the system provides a deeper understanding of acupuncture that is research supported and clinically proven. So I would just want to show you recent publications, the books on neuropuncture. The first one is Neuropuncture Clinical Handbook of Neuroscience Acupuncture, which actually explain a lot of foundation of neuropuncture. And so published by Dr. Corradino. And the second book, Neuropuncture Case Studies and Clinical Application, in volume 1, we published in December 2020, and it's co-authored with Dr. Corradino and me. And then our second volume is coming up. So I just want to briefly tell you what's the content in this volume 2. We actually talk about the case studies and clinical experience and from the patients in all different disciplines like internal medicine, such as anxiety, depression. We also have cases in type 2 diabetes. We have pain management for carpal tunnel syndrome and for sciatica. And we also have insomnia and case studies. We have and so much, and volume 2 cover even more so. And also I want to mention more publications. So in April this year, we published a paper in Medical Acupuncture Journal, and it's the effective treatment method for patients who with subjective tinnitus accompanied with hearing loss, with case reports. In this report, we quoted 14 cases, and all these case studies coming from all over the globe from the practitioner who practice neuropuncture. And also in June this year, we presented the case in the Society of Acupuncture Research Conference, and about COVID-related loss in smell and taste. So of course, and tonight we're not going to go through it in detail, but which in the conference we're going to go through all the in detail. So I just want to give a brief view about what a tinnitus is. Guess what? There's 50 million Americans suffer tinnitus. About 1 in 6 people suffer from that. And then, so let's see. Okay, so everyone think, oh, it's just kind of annoying, a noise in my ear. However, okay, tinnitus actually is a serious health condition. It can be debilitating and cause distress, depression, sleep disturbance, frustrations, possible suicidal thoughts. This can be very serious. Actually, I have one of the patient came to me, suffered the whole year she could not sleep for a whole year because of the tinnitus. Okay, so it can be pretty serious. And in the medical approach, what do they use? When you go to the doctor, is I have tinnitus, what do they suggest for you to do? And so far, the only way they provide you the intervention for tinnitus is a coping mechanism, such as give you the noise canceling, the machine, or the hearing aid, or the sound therapy, or the cognitive behavior therapy, or treating your TMJ, because sometimes the TMJ can cause that. So those are the possible coping mechanism that treating the tinnitus. I also want to just give a brief review about how do we approach as a TCM practitioner. And I'm pretty sure a lot of your patients come to you saying, oh, I have tinnitus, I have a hearing loss. What do you treat? So in general, what we learn from school, the Chinese medicine, is that, oh yeah, I have kidney weaknesses or the kidney yin deficiency. Because the reason why that is, because the patient will complain, yeah, the noise get louder at nighttime, so it must be kidney yin deficiency. Or you're under a lot of stress, hypertension, or could be liver yang rising, and that's the diagnosis. So the treatment focused on kidney meridians, okay, as well as points along liver and gallbladder to help the root problem. And guess what? The WHO, which is the World Health Organization, they actually give a tinnitus protocol recommendation, which is the needles on the points along the ear and the Eustachian tube. So they, of course, offer moxibustion. There are plenty of papers published the treating tinnitus in the PubMed, moxibustion, herbal supplements, electroacupuncture, manual acupuncture, laser acupuncture, and so on. So I also want to give you a glimpse of how we approach that as a neuropuncturist. So as Peter mentioned about the cranial nerve, yes, and we approach tinnitus, there's 5 cranial nerves actually involved, and also the spinal nerve involved. The 5 cranial is trigeminal nerve, facial nerve, vestibulocochlear nerve, and glossopharyngeal nerve, vagus nerve. You heard so much from Peter about that, and also the spinal nerve involvement, okay? And once we do know about the neuropathological mechanism, then we know what the pathological neural tissues to target. And then we decide on the acupuncture points and dosage and prescription, and we're very clear about our approach to treat tinnitus. And then we can communicate to the patients, and we communicate to the referral doctors and what we do. And I just wanted to tell you, in this October, the conferences, we definitely will go through all the details and how do we treat the case studies and the result of treatment. And also I wanted to tell you the exciting news about our next research project is Parkinson's disease. And with the DACM I mentioned about, and we actually measure the pre and post neuropuncture to demonstrate and document the measurable changes in the substantia nigra. In addition, document the change, like Dr. Hadar would use a saliva test to measure the saliva transmitter dopamine levels. So this is all, we combine all the research, all the knowledge to come up with a treatment plan for our patients. So it's getting late, so I just wanted to see you all there to attend our Neuroscience Acupuncture Conferences. Thank you.
All right. So I'd like to see if we have any questions, but Jeff, I don't see the questions right now, unfortunately. I know we're a little bit over, so I don't know if we want to just go into the end in the special offer.
Michael, so to the right of the chat, you'll see the questions tab. It should have like a little red dot next to it.
So I moved that over because it seemed like everyone was seeing my screen, and
Okay.
I wanted to change the side, so I can't seem to get that back without saying.
I just took your screen down.
Oh, there you go. Okay.
All right. Do you see that now?
Yes.
Okay, perfect. So if you go all the way to the bottom, those are the oldest questions, and the newest questions will be at the top of that list.
I don't see the questions. I'm sorry.
So do you see the chat tab on the right?
No.
Do you see in the bottom right-hand corner
There
of the
you go.
screen?
I got it now. Got it.
All right,
Okay.
perfect.
Now you got
All
it.
right.
Perfect.
Sorry about that.
No, my bad. Okay,
All
everyone.
good.
Sorry about that. Rookie mistake. All right. So I think this is a question towards Peter. Do you keep pulse oxygen meters on throughout the entire treatment to monitor?
Yep, we do in a lot of cases, for sure. Mainly for safety and time dosage. So we do find that a good example is in the early stages of a post-concussion syndrome, maybe the first 21 days, people will generally not sustain 30 minutes of treatment. You'll start to see the heart rate variable getting inhibited and oxygen levels going down. That means treatment's done, take everything out. So we do that a lot, and it reduces a little bit of the reliance on the subjective style of pulse diagnosis, which I think is important, and it gives you really clear markers about the tolerance of treatment. So we do run that right throughout treatments for sure. Yep.
Okay, so throughout the treatment, excellent. I think this one is for Dr. Helen Law. I am really concerned about many patients' loss of sense and smell and taste. Absolutely, I know there's a big concern of that right now with COVID, and even versus parasemia. Okay, will we talk about that today? Well, I don't think today, but I think Dr. Law can explain what she's going to talk about later on.
Yes, right.
So later on.
Yeah, later on. Yeah,
Okay.
I just wanted to
At the
mention
conference.
at the conference, we'll be going through all the details and
Okay.
how do we come up with the prescription, how do we treat it, and how the patient respond, and all the study we had in such a detail.
Excellent. So if you didn't get that, she's going to go over the detailed treatment prescription, how to treat it, how to assess it, and then her personal case studies and outcomes. Okay. Do you have a treatment for edema lower leg after surgery? I'm not sure who that goes to. Let's see if there's a rank here. Okay, here's for Dr. Hadar. In other words, obtaining the functional medicine certification bypasses the L.Ac lab test ordering issue, or perhaps it varies by state. So I think what they might be asking is, if you get a functional medicine certification, does that bypass our scope of practice to order certain labs? I know you've worked in multiple states yourself, Dr. Hadar.
Yeah.
Did you find any differences in state to state?
Well, in New York and I think New Jersey, you can't order lab tests. Am I correct?
I don't
I
know,
believe
but
that's true.
even
But
with
in California, Florida, you can order in most states. But since I've lived in California and now I'm in Florida, I can still order anywhere. Depends on where the patient is. I don't have a patient in New York that I think of, but I have patients everywhere else, Canada included. So it wasn't a problem ordering, but not in New York. So I know from my colleagues in New York and New Jersey that you cannot order lab tests there. Am I correct?
I think that varies. I think someone from the
Yeah.
state should really give a definitive answer. If we don't know, we shouldn't say. But yeah, I think it might vary from
No, I
state
know
to
they
state.
can't. Yeah, I know for sure they can't order in New York. I think New Jersey too, but I'm almost certain that
Okay.
even if you practice functional medicine or acupuncture or maybe even naturopathic medicine, I'm not sure, in New York and maybe New Jersey, you cannot order lab tests. I don't know why. Regulations.
So check your states, everyone. You have to check your states and do your due
Yeah, of
diligence so you
course.
don't get yourself into a pickle.
Right.
What electrical acupuncture device do you recommend? I think most of us all use the Pantheon, different variations of it. Let me see. Okay, here's another one for Dr. Hadar. Does Vibrant Health Service acupuncturists in states like New Jersey or Pennsylvania that do not include lab ordering in their scope? Good question. Okay, so it seems like there's a couple practitioners from those states, and they
Yeah.
are. I didn't know that was a problem.
I
will
can
find
tell you,
out.
I'm in New Jersey, and I can't order from Vibrant.
You
You
cannot.
could.
Yes, I can.
Oh, you can?
Yeah.
Oh, okay. That's great. Okay.
Now,
From New York, I'm curious then. Yeah.
Yeah.
I know.
so there's another question here. Is this just for human medical acupuncture? I'm a veterinarian. Jane, I think I'd say this is definitely mainly for human acupuncture. There are some crossovers that you can, I'm sure, apply, but it's definitely be geared towards human acupuncture. Okay. Okay. And then can you comment on taste and smell recovery outcome from auricular acupuncture? Well,
auricular acupuncture treating smell and taste, probably, I don't think there are too many research paper regarding that. Probably won't be as effective.
okay. All right. Well, there you go. If there's any more last minute questions, let us know. We're running over a little bit. I want to make my announcement. If everyone's okay, I'm going to share the announcement. Jeff, does that sound good?
Sounds great to me.
All right, good. Let me see what we got here. What am I doing here? What am I sharing with everyone? What's going on here? All right. Can you guys see my screen? Looks good? Okay.
You can.
All right. So once again, I just want to thank everyone for attending tonight. I really appreciate your time and commitment to try to learn some new evidence-based neuroscience acupuncture. Again, this conference is biannual, but this one is October 23rd and 24th. The theme is advancements in functional neuroscience acupuncture. Again, we have Dr. Hadar Elbaz speaking about functional medicine. You'll add that possibly to a component of telemedicine to your practice. We have Peter Larking, functional neurology, assessing the cranial nerves and how to treat those and rehab them back into health with electrical acupuncture prescriptions. And Dr. Helen will be giving out her prescriptions that she used for tinnitus and hearing loss and loss of sense of smell and taste due to COVID. So for tonight, everyone that is in attendance, this is the special we're going to give all of you. We're all going to reverse and put the early bird special back on code for you. We're going to put an additional 10% off using that LASA code right now with that registration link down below. And on top of that, what I'm going to do, just for the attendees that are observing right now, you have till midnight tonight to register. I will personally guarantee the satisfaction of you enjoying our conference, okay? You will have some terms and services that you can read before you register, but I will give you your money back if you send me an email within 48 hours that you were not happy with our speakers. I feel very confident with our content. I feel very confident with our speakers, and hearing them tonight between the amino acids, neurotransmitters, telemedicine, functional neurology, cranial assessment, and then clinical applications to Dr. Law's published neuroscience acupuncture prescriptions, I'm telling you, you're all going to benefit from it. This is a need that our profession needs. So for you guys right now that are live right now, and we do timestamp the registrations, money back guaranteed. You have 48 hours to send an email at the end of the conference. And then when you do attend, I recommend you're going to be at home. So have a glass of wine, have a cup of tea, a cup of coffee, get some notes out, write your questions down. There will be Q&A with me and our speakers. Two Q&As with Dr. Hadar, 2 Q&As with Dr. Helen, and then we'll probably have 4 Q&As with Peter Larkin with cranial nerve assessments and functional neurology. So again, special offer, early bird special plus 10% off, and everyone that registers now until midnight will have a money back guaranteed on your satisfaction. Read the terms of the service before you register. Enjoy it. Click the link below. Hope to see you all there.
Thank you, Michael. Thank you, Dr. Hadar. Thank you, Dr. Law. Thank you, Peter. Thank you to everyone for attending tonight. This was incredible. Our next webinar is going to be on October the 7th. It is going to be Acupuncture plus CBD, Clinical Protocols for 6 Case Studies. So please don't miss that. And I just want to thank all of our speakers for taking their time tonight. And I want to thank you all. Have a great evening, and we will see you next time.
Thank you. Take care.
Thank you. Good night, everybody.
Thank you.
Thank you, everybody.
Thanks, Lhasa.
Bye.